As we age, with attention often focused on maintaining the health of our heart, brain, and bones, the condition of our feet is frequently overlooked, those tireless workers that carry us through decades of life. Often, their existence goes unnoticed until pain or weakness draws our attention to them. However, for older adults, foot health is a key factor determining not only comfort but also independence, stability, and overall quality of life. Foot problems in the elderly are a surprisingly common phenomenon, profoundly impacting their daily lives. Sarcopenia, the age-related loss of muscle mass, weakens the feet and legs, turning every step into a real challenge. Limited joint mobility, thinning cartilage, and chronic inflammation reduce mobility and increase the risk of falls, threatening independence and self-confidence. Circulatory and nerve conduction disorders can cause numbness, slow wound healing, and lead to serious complications, especially in people with diabetes. But do not despair, because there is also good news. Proper nutrition can protect and restore foot health, bringing back the joy of movement and an active life. While the primary focus in discussions about nutrients is usually on vitamins and minerals such as calcium, vitamin D, and magnesium, there is an equally important group of non-vitamin and mineral compounds that directly support the strength, structure, and function of the legs. So, what nutrients will help maintain the health and strength of your legs for years to come? The answer to this question may be the key to an active and fulfilling longevity. First of all, it is worth paying attention to the role of protein in maintaining health in adulthood. One of the earliest signs of aging is a decrease in leg functionality. Climbing stairs can become a real challenge, long walks become exhausting, and simply getting up from a chair requires significant effort. These subtle changes may indicate the development of sarcopenia, a gradual loss of muscle mass and strength, which, according to some data, affects up to a third of people over 60 years of age. The logical question arises, is this physical decline inevitable, or can we take control of the situation? In other words, can a certain nutrient help maintain the strength and energy of our legs over time? The answer to this question is yes, and the key substance is protein. Protein is not only necessary for those involved in bodybuilding or professional sports. For older people, it is an essential element of healthy aging, especially when it comes to maintaining the functionality of the lower extremities. Muscles are made of protein, and as we age, the body loses its ability to effectively use it for repair and regeneration. This phenomenon, known as anabolic resistance, means that older people need more high-quality protein to stimulate muscle tissue growth than younger people. Protein rightfully takes center stage in maintaining the health and strength of the human body, acting as an indispensable source of building materials for muscle tissue, which is especially important for maintaining the strength, balance, and mobility of the legs. Of particular note is leucine, an amino acid abundant in dairy products, eggs, and lean meats, which plays the role of a biological switch, activating a key growth pathway in the body known as mTOR. It is leucine that sends a clear signal to the body to start the process of building muscle mass. Without enough leucine, even food rich in protein may be ineffective in maintaining the muscle mass necessary for leg health in old age. Insufficient protein intake can lead to a gradual but noticeable decline. Weakening of the legs, increased risk of falls, decreased mobility, slowed recovery from injuries, and, as a result, loss of independence are just some of the possible consequences. Even with sufficient calorie intake, protein deficiency can lead to imperceptible destruction of muscle tissue, which is replaced not by strength, but by fatigue. Fortunately, this problem can be actively addressed. Modern research convincingly shows that older people should increase their protein intake compared to previously recommended norms, bringing it to 1.2 to 1.5 g per kilogram of body weight per day. It is important to distribute protein intake evenly throughout the day to overcome the so-called anabolic resistance and ensure optimal support for muscle tissue. Instead of restricting protein intake in the evening, it is advisable to ensure an adequate supply of this essential nutrient with each meal, paying particular attention to breakfast and lunch, when many older adults tend to reduce its quantity in their diet. Moreover, the sources of protein play a significant role. Proteins with a high leucine content, such as whey, eggs, fish, chicken, and Greek yogurt, are particularly effective in maintaining leg health and functionality. Plant-based alternatives, including tofu, lentils, and quinoa, can also be beneficial when properly combined. For individuals with reduced appetite or difficulty chewing, protein shakes and powders offer a convenient and concentrated option. Furthermore, it is worth paying attention to omega-3 fatty acids. For many people, the word fat is associated with something to be avoided. However, a certain type of fat can have the opposite effect, helping to relieve joint pain, improve blood circulation in the legs, and protect the nerves that enable movement. Omega-3 fatty acids possess precisely these properties, and their benefits are particularly important for leg health. Pain, stiffness, and swelling in the legs are common in older adults and are often associated with chronic low-grade inflammation. Regardless of the cause of discomfort, whether it's arthritis in the knees, calf pain, or painful ankles, inflammation often acts as a hidden factor that worsens leg comfort and mobility. In this situation, omega-3 fatty acids come to the rescue, acting not as a quick fix but as a natural and long-term aid in the fight against inflammation. Unlike widely advertised medications that only temporarily mask pain, omega-3s work from the inside out, gradually reducing the body's inflammatory response at the cellular level. Eicosapentaenoic acid (EPA) and docosahexaenoic acid (DHA), the two most active types of omega-3s found in fish oil, affect the synthesis of signaling molecules called eicosanoids and resolvins, compounds that help stop inflammation rather than increase it. As a result, joints gain greater mobility, swelling and stiffness are reduced, and legs feel less burdened by constant discomfort. However, the beneficial effects of omega-3s are not limited to relieving inflammation. With age, blood circulation in the lower extremities naturally deteriorates. The small capillaries that deliver oxygen and nutrients to the legs and feet function less efficiently, leading to cold feet, cramps, slow healing of injuries, and even more serious complications in people with diabetes or peripheral artery disease. Omega-3s provide support by improving the function of the endothelium, the inner lining of blood vessels. They stimulate vasodilation, supporting continuous blood flow and preventing blood clots, which means that more oxygen and nutrients reach the muscles, nerves, and skin of the legs. Optimizing blood flow in the lower extremities is not just a pleasant procedure but a foundation for strengthening legs, speeding up recovery after exercise, and minimizing the risk of complications. Significant evidence suggests that omega-3 polyunsaturated fatty acids have a protective effect on the nervous system, especially for those experiencing tingling, burning, or numbness in the legs, typical signs of peripheral neuropathy. Omega-3 acids help reduce oxidative stress and stimulate the regeneration of nerve cells, helping to maintain sensitivity and reduce discomfort in the lower extremities. This is especially important for older adults with diabetes or vascular disease, as loss of sensation can lead to unnoticed injuries or infections. Where can you find these valuable fatty acids? The best sources are fatty fish that live in cold waters, such as salmon, mackerel, sardines, and anchovies, which are rich in eicosapentaenoic (EPA) and docosahexaenoic (DHA) acids. For those who do not eat fish regularly, there are alternative options: high-quality fish oil supplements or algae oil, suitable for vegans. The optimal dosage varies depending on individual needs, but numerous studies confirm that for achieving anti-inflammatory and cardiovascular effects, it is recommended to consume 1,000 to 2,000 milligrams of combined EPA and DHA per day. Thirdly, it is worth paying attention to collagen, an invisible but vital component of leg health. Beneath every confident step, every flexible knee, and every steady ankle lies a complex network of collagen. This protein permeates tendons, providing them with strength and elasticity, cushions joints, reducing friction and wear, and gives ligaments the necessary resilience, maintaining the integrity of the leg structure. Collagen literally holds the legs together, ensuring their functionality and stability. However, over time, this supporting matrix gradually weakens. Joints begin to signal discomfort, knees lose their former mobility, and legs lose the feeling of reliability and springiness that was characteristic of them in youth. A natural question arises: is it possible to reverse this process caused by the relentless passage of time? Can collagen restore the lost integrity to aging legs? The answer is optimistic, and it begins with collagen peptides, the building blocks of this important protein. Collagen is the most abundant protein in the human body, forming the basis of connective tissues that provide support and structure to various organs and systems. Unfortunately, after the age of 30, the body's collagen production begins to decline steadily, and this process worsens with each passing year. By the age of 60 to 70, this decline becomes noticeable, manifesting itself in every creak of the joints and every strained tendon. Unlike muscle mass, which can be restored with exercise and sufficient protein intake, collagen loss occurs gradually and less noticeably, but its consequences are no less serious and noticeable. This is where collagen peptides come into play, representing more than just dietary collagen. These hydrated collagen fragments are broken down into short chains of amino acids, which ensures their rapid and efficient absorption into the bloodstream. Once in the body, they are not simply dissolved but are directed directly to the joints and connective tissues where they act as messengers, activating the natural production of collagen. Clinical studies show that regular consumption of collagen peptides leads to a reduction in joint pain, increased flexibility, and even improved bone mineral density. This means greater stability of the knees, elasticity of the ankles, and a reduced risk of soft tissue injuries, which can take a very long time to heal in older people. However, collagen is important not only for strength but also for ensuring freedom of movement. When collagen-rich tissues receive sufficient support, the legs move more smoothly, the knees glide without creaking, and the Achilles tendon flexes without inflammation. The plantar fascia, a strong band of tissue connecting the heel to the toes, supports every step without overexertion. All these small but important details of leg function depend on a healthy collagen structure. It is worth noting that collagen does not act alone. To achieve maximum effectiveness, it needs key allies, in particular vitamin C, which plays the role of an activator of collagen synthesis. Without sufficient vitamin C, the body cannot effectively produce or restore collagen regardless of its intake. That is why many manufacturers of high-quality collagen supplements include vitamin C in their composition or recommend taking them together with foods rich in this vitamin, such as citrus fruits or sweet peppers. It is important to consider not only the composition but also the regimen. Clinical studies show that the most noticeable improvements occur with daily supplementation for 8 to 12 weeks. The sources of collagen also play a role. Collagen peptides are most often extracted from cattle, bovine collagen, marine fish, fish collagen, or pigs, porcine collagen. All of them contain important amino acids such as glycine, proline, and hydroxyproline, which the body needs to restore connective tissue. Marine collagen, in particular, is valued for its high degree of digestibility. However, bovine collagen remains the most studied in terms of its ability to support joint and bone health. Is there a way to restore the energy to cells that fuels strong and resilient legs, especially in old age? This is where creatine comes to the rescue, a nutrient that is often mistakenly associated only with bodybuilders but which is increasingly recognized as an effective means of maintaining health in the aging process. Creatine is a natural compound that accumulates in muscles and serves as a kind of quick energy reserve. With every movement, whether it's lifting, walking, or lifting weights, especially when speed and strength are required, muscles use creatine to restore ATP, adenosine triphosphate, the molecule that provides muscle contraction. It's like having a backup power generator for your legs. Over time, the body's natural creatine stores are depleted, leading to a decrease in the ability to generate the energy needed for active movement. This, in turn, causes rapid leg fatigue, slowed gait, and a gradual deterioration of balance and self-confidence. However, creatine is one of the most studied and effective means of combating age-related muscle mass changes. Studies show that creatine intake, even when combined with moderate strength training, promotes increased lower body strength, muscle mass gain, and improved functional capacity in older adults. Meta-analyses confirm that older people taking creatine during regular exercise show significant improvements in walking speed, chair stand time, and leg strength compared to those not taking the supplement. Even in sedentary or frail individuals, creatine appears to help maintain muscle mass, providing the legs with a baseline level of strength even in the absence of intense training. The benefits of creatine are not limited to muscles alone. Emerging research suggests that it may also support bone density, likely by increasing the load that strengthened muscles place on bones. This is especially important for the legs, which bear the body's weight and are at risk of fractures from falls. Strengthening muscles helps strengthen bones, and creatine helps maintain both of these aspects. Unlike other nutrients that take months to show an effect, the positive changes from creatine intake are often noticeable within weeks. People report increased energy during walks, improved stability when getting up from a chair, and an overall sense of restored leg functionality. So, how should this substance be taken? The most common and well-studied form is creatine monohydrate, available to everyone. A daily intake of 3 to 5 grams is generally effective and safe for older adults. There is no need for any loading phases or cycling, only consistency is important. It can be easily mixed with water or added to various smoothies, and it is recommended to take it with food for optimal absorption. And what about side effects? Creatine has been thoroughly studied, and when taken in appropriate doses, it is considered perfectly safe even for older people. Minor water retention may occur at the start of intake, but this usually passes quickly. It is important to emphasize that concerns about negative effects on the kidneys in healthy people have been largely refuted in clinical trials. Moving on to the next substance, it is worth mentioning glucosamine. This element is not flashy, nor is it a trendy superfood or performance-enhancing supplement. However, for decades it has remained one of the most researched nutrients designed to support joint health, especially in the context of osteoarthritis. This is a progressive destruction of cartilage that affects millions of aging people worldwide. The uniqueness of glucosamine lies in the fact that it is not just a pain reliever. It is a building block, a structural component of the molecules that form cartilage, synovial fluid, and connective tissue. It can be seen as the raw material needed to restore joints. Over time, the human body undergoes changes, in particular, its ability to maintain and regenerate cartilage decreases. This leads to a gradual thinning of joint surfaces, the occurrence of inflammatory processes, stiffness of movements, and pain, especially in the joints of the lower extremities, which experience the greatest load. The knee joints, in particular, bear the brunt of the body's weight. Glucosamine plays an important role in maintaining the body's natural production of cartilage and also helps maintain the necessary consistency of synovial fluid, which provides lubrication and nutrition to the joints from the inside. Numerous long-term studies, including those analyzed in the Cochrane meta-analysis, have demonstrated that glucosamine, especially in the sulfate form, can reduce joint pain and slow the progression of cartilage destruction, especially in the knee joint. Although most studies focus on the knee joint, the principles of glucosamine's action also apply to the smaller joints of the ankle and foot, where cartilage damage can lead to equally serious consequences. However, perhaps the most important aspect of glucosamine's action is its stabilizing effect. Unlike agents that only provide temporary pain relief, glucosamine provides structural support to the joints. It works gradually, strengthening the internal framework of the joints over time. People who take glucosamine often report minor but noticeable improvements, reduced joint creaking, easier bending, smoother movements, and greater confidence when performing everyday tasks such as climbing stairs or walking on uneven surfaces. Glucosamine also pairs well with chondroitin, another substance that supports healthy cartilage. The combined use of these two components demonstrates moderate but sustained improvements in joint mobility and comfort. Despite all the controversy, glucosamine retains its significance, especially in the early stages when joint degradation has not yet reached a critical point. It's not a quick fix, but rather a long-term strategy. But it is this approach that proves to be most effective in maintaining leg health in old age. The recommended dose of glucosamine sulfate is 1,500 milligrams per day, which is advisable to divide into 2 to 3 doses and consume with food. The first signs of improvement may appear only after 4 to 8 weeks, so regularity of intake plays a key role. It is important to note that people with seafood allergies should exercise caution, as some glucosamine supplements are derived from shellfish exoskeletons. Fortunately, there is now a wide range of plant-based or synthetic alternatives available. Curcumin, traditionally used in Ayurvedic and Chinese medicine, has been attracting increasing attention in recent years due to its pronounced anti-inflammatory and antioxidant properties. And this is not just folk wisdom. Modern scientific studies confirm the effectiveness of curcumin, especially in the context of chronic diseases of the joints and muscles. Curcumin demonstrates promising results in the treatment of osteoarthritis, tendinitis, and inflammatory pain, which often affect the legs and lower extremities in the elderly. At the cellular level, curcumin exerts its healing properties by interfering with the complex process of inflammation. It acts as a blocker, neutralizing key enzymes such as COX-2 and 5-lipoxygenase, as well as important signaling molecules such as TNF-alpha and interleukins, which are the main culprits behind swelling and pain. It is important to note that, unlike traditional nonsteroidal anti-inflammatory drugs, NSAIDs, which are often associated with gastrointestinal side effects and long-term health risks, curcumin has a milder effect on the body, especially when using its optimized forms. Clinical studies convincingly demonstrate that curcumin can be as effective as ibuprofen in relieving joint pain and reducing stiffness in patients suffering from arthritis, while having a significantly more favorable safety profile. For people whose legs are subject to age-related changes, this means reduced swelling in the knees, reduced tension in overloaded tendons, and increased comfort when moving. Curcumin is especially useful for conditions such as plantar fasciitis, where inflammation in the thick band of tissue along the bottom of the foot causes excruciating heel pain with every step. This condition is notoriously difficult to treat. Curcumin's unique ability to modulate pain sensations and accelerate tissue repair makes it one of the few natural compounds that not only alleviate symptoms but also potentially address the underlying causes of disease. In addition to its beneficial effects on joints and tendons, curcumin's antioxidant properties provide broader protection for the body. Aging muscles and nerves are constantly exposed to free radicals, unstable molecules that damage tissues over time. Curcumin neutralizes these destructive radicals, thereby helping to preserve muscle integrity and maintain nerve health. This is especially important for preventing leg numbness or neuropathic pain, especially in people with diabetes or circulatory problems. It has long been known that curcumin has low bioavailability, meaning that it is poorly absorbed by the body in its natural form. However, modern scientific developments have solved this problem. Many improved formulas are available on the market, such as curcumin with piperine, black pepper extract, phytosomal curcumin, and nanocurcumin, which are more effective. Thanks to these innovations, the therapeutic potential of curcumin is becoming increasingly accessible. The recommended dosage for maintaining joint health and fighting inflammation is 500 to 1,000 milligrams of standardized curcumin extract per day, although individual needs may vary. With regular intake, most people notice positive changes within 4 to 6 weeks. This isn't an instant fix, but a gradual improvement aimed at enhancing comfort and freedom of movement. In conclusion, this review has explored 6 valuable nutrients, each playing a crucial role in maintaining healthy legs, supported by scientific research. Protein serves as a building block for maintaining and restoring muscle mass, helping to combat the natural age-related loss of strength. Omega-3 fatty acids combat chronic inflammation that restricts joints and impairs circulation, ensuring free blood flow and reducing pain in the legs. Collagen peptides strengthen tendons, ligaments, and cartilage, providing the legs with the necessary structure and stability, improving mobility and joint comfort. Creatine activates the muscle energy system, infusing each step with renewed strength and endurance, which is especially important for preventing falls and maintaining independence. Glucosamine promotes the restoration and protection of cartilage tissue in the joints, cushioning every movement and supporting flexibility over time. Curcumin provides natural relief from chronic inflammation and pain, offering a gentle yet effective way to maintain freedom of movement in the legs, even with chronic conditions. The combined action of these components, like a well-tuned orchestra, provides a lasting and sustained effect. One component strengthens muscle tissue while another cares for joint health, providing them with essential nutrients. While one fights inflammation, another actively promotes the recovery process. Of course, everyone is unique and the body's response to various substances may differ. Therefore, before including any new supplements in your diet, it's wise to consult with a doctor, especially if you have any chronic conditions or are taking prescription medications. A personalized approach will ensure the safety and effectiveness of these nutrients specifically for your body. The path to healthy legs doesn't begin with surgery, injections, or passively waiting for a condition to worsen. It begins with proper nutrition, with conscious and informed decisions made gradually, step by step. Now that you have the necessary knowledge, backed by scientific data, you have the opportunity to act. Provide your legs with what they truly need and allow them to carry you forward, giving you strength and confidence that surpasses your previous capabilities.